Good evening, everybody, and welcome to this evening's forum, which is what to ask your healthcare provider. So from all of us at IDF, welcome. We are so glad you're here. And I always say this, whether it's your first time or your 100th time, thank you. Thank you for joining us. Thank you for your support. And we are going to, as we always do, start out with the mission. The mission of the Immune Deficiency Foundation is improving the diagnosis, treatment, and quality of life of people affected by primary immunodeficiency through fostering a community empowered by advocacy, education, and research. And we have a huge vision. Our vision is that we seek to ensure that everyone in the U.S. affected by PI has a fully informed understanding of the PI diagnosis that affects them, all available treatment options, the expected standard of care, and all of their opportunities for connection and support within the PI community. And as always, a disclaimer that these events that IDF presents offer a wide variety of educational presentations, as you know, and that the information presented during this event is not medical advice, nor is it intended to be a substitute for medical advice, diagnosis, or treatment. Please always seek the advice of a physician or other qualified health provider with questions concerning a medical condition. And please never disregard professional medical advice or delay seeking information based on anything you've heard in this event. So tonight, what to ask your healthcare provider. So at this time, I am honored to introduce our presenters. Mary Hintermeyer is a nurse practitioner at Wisconsin Children's in Milwaukee. She has been a member of the Nurse Advisory Committee for many years and is currently the chair of our Nurse Advisory Committee and has presented at other live events and virtual events. So thank you, Mary, for being with us. And then I would like to introduce Brian Rath. Brian is an attorney, and he is also a member of the PI community and is on a leave from the Board of Trustees. So Brian, we are so glad to have you with us tonight. And then I would like to introduce Dr. Nicole Rochester. And for over 20 years practicing as a pediatrician, she decided that it was time to share what she learned while she was taking care of her father when he was ill, to help other people be their own healthcare advocate, communicate with their providers, and to live their best life. So Dr. Rochester has established her own company called Your GPS Doc. So you'll hear about that. So thank you tonight for being with us, Dr. Rochester. Thank you, Brian. Thank you, Mary. And I can't wait to hear what you have to share with us. So at this time, turning it right over to you and pulling down these slides.
Awesome. Thank you so much, Kathy. But it is my honor to be here. I am thankful for this invitation and the opportunity to spend some time with Mary and Brian and with all of you. We are going to be talking about how to communicate with your healthcare provider, and we're going to really engage in a conversation. It's a panel, but it's really going to be a conversation and a dialogue that we hope will be very informative to those of you who are joining us tonight. As Kathy mentioned, we are going to be taking questions. We've received some questions already, and we encourage you to, as we go along, to include additional questions in the Q&A box. We do ask that you keep your questions limited to the topic for tonight, which is how to communicate with your healthcare provider. As Kathy shared, there is another upcoming forum about COVID. So we will not be addressing questions tonight related to COVID-19, although we appreciate and understand that that is also a very pressing topic. So with that, I want to welcome Mary and Brian, and we're going to go ahead and get started. The first question that I have for the two of you and for us to discuss is, I want to know from your perspective, why is it important for patients with PI, for their family members, for parents, and other support people to ask questions at medical appointments? And Mary, we'll start with you.
Okay, thank you. And I also wanted to say that I'm very excited to be here because it's always been my focus to engage our patients, and education is probably the key component of being successful in managing your disease. So leading right into what you had asked me is, if you want to have a good outcome with your disease and you want to be able to understand your therapies, how do I implement my therapies into my daily life so that they'll work for me and I can reach my best potential, I've got to be able to understand my disease. And the only way I can do that is with really good, thorough conversations with my healthcare providers. This includes the physician. There's usually a nurse, maybe a nurse practitioner, some other people, a pharmacist might be involved in helping you reach this state. And part of the problem sometimes is these are very complicated medical issues. The patients often don't know what to ask because they don't have a good understanding of a very complex medical condition. So I think you need to kind of start out in the beginning with clarifying the terms that you're using and helping the patient understand that. So that guides them to say, what questions are most important to me? Because they might be different for you versus another patient.
Excellent. I completely agree. And I love that you mentioned that a lot of times patients and families don't know what to ask. And we're going to address that as we move throughout this program. But that's so incredibly important. And I think that a lot of times when we don't know what questions to ask, we decide to stay silent. And I think that that's, absolutely something that you don't want to do. And so we're hoping today that as we go through this discussion, we're going to provide you with some examples and kind of a framework so that even if you're not exactly sure what to ask, you don't leave those appointments without having some basic information. So Brian, I'd love to hear from you as a member of the PI community for a while, and someone with some experience. What's your perspective as a patient and also as a parent? Why is it incredibly important to ask questions in the medical appointments?
Thank you. And I have been a patient. I am, don't want to have to date myself, but I am 49 years old and I've been a patient all my life. I've known about my primary immune deficiency since, for as long as I've, been alive for the most part. So I was a child growing up in this, learning from my parents how to be a patient. And then I have been an adult patient as well. And the most important reason why we as patients need to ask questions and be informed is it's my body. And it's nobody else's body. No one knows how I feel. No one knows what's going on with me. I know best about what's going on in my body. And so it is incredibly important for me, one, to understand what my condition is, what my diagnosis is, and know the basics of what's going on in my body. And then two, be able to communicate with the doctors because they don't know. And so I want to be able to know, to be able to communicate, not just ask them questions, but to inform them of what's going on inside of me, because that's the way that we're going to best be able to treat me and my body. So that to me is the most important reason why there needs to be open communication. And I, as the patient, need to know what's going on, both walking into the appointment and leaving the appointment and during the appointment.
Absolutely. Thank you, Brian. I love that you said it's my body. And I also love that you said that the doctors don't know. And as a doctor, I 100% agree with that. I regularly tell my clients that you are the expert. You are the expert for your body. You are the expert for your medical condition. And despite the fact that, Mary and I have lots of years of education under our belts and training and things of that nature, but none of my medical knowledge, none of my expertise, there's no textbook that can tell me what's going on inside of your body. So I love that you've established that right from the beginning, that you all are the experts for your medical conditions. If you're a caregiver, if you're a parent, you're the expert for the person that you care for. So I appreciate that. So we know that it's not easy, right? If it was so easy for patients and family members to ask questions, then we wouldn't see all the complaints that I see on social media. And, we wouldn't have some of the challenges that we have. So in your opinion, what are the main barriers that limit or prevent patients and their support people from routinely asking questions during medical appointments? And Brian, we'll start with you this time.
Well, there's a few barriers. One, we don't just have a cold. We have a condition that is a rare condition that's hard to understand. And it's daunting to be a patient and be told we have an immune deficiency and then have to know what the immune system is and how that works. And we're complicated. And so that's, to me, one of the hardest parts of all of this is, we don't have something simple. What we have is complicated and it's rare. And so, the best way for us to be able to communicate with doctors is to try to learn something about what we have to begin with. And quite honestly, we're talking to a bunch of people that have signed up for a forum at IDF. That's the first step, is educating ourselves. I am a huge proponent of all of IDF's literature, all of our books and our pamphlets for the healthcare providers, and they're also for us. And just to get a basic understanding of this complicated disease that we all share. What does it mean to us, for us first? And so that's the hardest part, is we don't necessarily understand what we have to start out with. And so how do we ask the right questions when we get into a doctor's office if we don't understand the basics of it? So I think that's the most important thing first, is for us to try to understand it on our own, and then also go to our doctors and ask, okay, I don't understand what's going on. Help me understand. That is step one, I think, of all of the communications we can have with our doctors.
That's really important. So just the overwhelm of the complexity of the diagnosis itself makes it difficult. That's a really, really good point. What about you, Mary, from a provider perspective? What do you see as some of the main barriers for just being able to engage in this type of dialogue in the medical setting?
So I'm going to bring up a term that maybe just a few people have started to hear about, but it has become in the forefront of healthcare professionals, helping them to understand how can we improve communication with our patients and how can we improve their understanding. And it's something called health literacy. So they're really starting to take a look at how do healthcare professionals speak to their patients, and are they really communicating the information that they think that they're communicating? So I'm very hopeful, with an increased focus on health literacy, that in the future, the communications with the patients are going to improve, and the communication tools will also change so that they're readily understandable by patients at different levels of understanding. The other thing that I think can be difficult with patients, and it depends where you're getting your healthcare from. If you live in a more rural area, you maybe have seen an expert in PI, but because of the distance, you see them maybe once a year, and then they're acting to collaborate in your care with a local healthcare provider who's not an expert in PI. And I think it's difficult for patients because they're going to ask those tough questions to the local healthcare provider who has limited time. They aren't going to know the answer. They're often going to push them off and say, well, call so-and-so's office, or call that person and ask, or they really don't know the answer, or maybe they might give some limited information, and that really discourages the patient from pursuing the question and getting an answer, and they kind of give up. So part of it, I think, has to be maintaining a really strong relationship with the PI expert that is managing your case, even if you only see them infrequently, to get your questions answered. There's always the issue of time. Patients come in and they always feel rushed. And what you might want to actually think about doing is maybe you have some separate visits or communications with the provider where I have to do an in-person visit because they have to check my lab work, do an exam, make sure I'm approved to get my, yearly immune globulin authorization in. But recognizing, maybe there's too much going on today. Can we set up a time where we will just connect either by phone or Zoom and we can just have an in-depth discussion? Sometimes it can be with the physician, oftentimes it's with the nurse or a nurse practitioner, because truthfully, the nursing staff usually has more time to spend with direct case management, solving the everyday problems. And a lot of the questions are everyday issues, like I'm having this problem with my infusion, I'm having this insurance issue, kind of breaking that up a little bit to promote some of the communication. And the last thing that I always worry about is, everybody views the healthcare providers as the expert. They're extremely educated. They've done research. They write papers. With that comes a little bit of intimidation to the patients. They feel uncomfortable asking a question. They're going to think I'm stupid. I asked this question 5 times. I can't keep asking it again. But it really has to be two-way communication. So I never want the patients to feel like it's up to me always to know what to say to my healthcare provider. We as healthcare providers need to remind ourselves and our colleagues that it's a very important part of our care that we make sure our communication is good and we seek out a response from the patients. Did you understand that? What more can I tell you? What other resources can I provide to you?
It's interesting, if I can just come off of what Mary said. I think sometimes a lot of what we have to do as patients is we have to educate our providers because our providers don't know what we have. And I've come across providers who think they know more than I do about hyper-IgM syndrome, which is my diagnosis. And okay, this person may have read an article on it one time or heard about it in medical school, but no, you don't know more than I do. I live with it every day. And I have walked into doctors' offices with the PDF download of hyper-IgM syndrome from IDF and said, look, this is exactly what I have. Let's talk about it. And so I've had resistance from providers, but I've also walked into, I had an allergist, I was meeting him for the first time, a new local allergist after I moved. And I walked in and I gave him the printout and I gave him some of my other literature I have. And he looked at me and he said, this is amazing. You're why I went into medicine in the first place. I don't need to see somebody else for an allergy shot again that I see 10 times a day. You're interesting to me and you're exciting to me. And that was like the greatest reception I've ever had in a doctor's office. But, me bringing this literature to him, I had to educate him on what this was, but he was excited about it and interested. So it's, it is a matter. We do often have to educate the providers about our specific disease because it is so rare.
And to me, as a provider, as a physician, it almost seems a little unfair. It almost seems like an unfair burden for you to bear. But I understand the necessity for that. And I love the story you just shared about, the physician that was open and even excited about that. I will be very transparent and share that many physicians are not, as you share. Many physicians, there's a certain degree of humility that is required to be a healthcare professional who is willing to say, I don't know. And I think that unfortunately, some of our colleagues don't necessarily have that skill or that attribute. And there's a lot of reasons for that. And I think because, we're often viewed as the experts, as we've been talking about, for some healthcare providers, it's a very difficult thing for them to just openly acknowledge that they don't know. And so with that, sometimes comes some of that pushback and some of that resistance that many of you have probably faced when you go to the doctor. I'll also share transparently, that as you all mentioned, time, or Mary, I think you mentioned, time is a really real factor. And we all feel that we want more time with our patients. Those time restraints are almost never dictated by the physician or the nurse practitioner, but by outside forces and things of that nature. But because of those time limitations, a lot of times when a healthcare provider sees a well-informed patient or family member come in with, a stack of papers or research articles, there's almost this immediate feeling of doom, like, oh my gosh, I have 10 minutes, I have 12 minutes, and I'm going to have to, read this material. But, like your doctor did, Brian, that's an opportunity to be educated. And even if the physician or the nurse practitioner doesn't have time in that moment, the correct response would be maybe, okay, we only have 15 minutes today. Thank you so much for bringing this information. I'm going to read this later on today. Or, is there anything really important, or can you summarize? There are ways to handle that instead of just kind of shutting down or resisting. I also wanted to circle back quickly on something that you said, Mary, about health literacy, and just, defining that for everyone, because a lot of times we hear literacy and we think about like the ability to read and write. But as you mentioned, health literacy really is our ability to understand and interpret medical information in a way that allows us to make decisions about our medical care. And you mentioned, Mary, that involves the healthcare provider checking in and assessing how well was that information received. And there have been tons of studies that have shown that what we think we're doing, how we think we're communicating and how we actually are communicating are often two different things. And so something that I used to employ when I was practicing medicine, and something that was taught to me in my pediatric training, is the teach back technique. And I want to just share that briefly with all of you. And that's basically a technique where if I, as the provider, am sharing information with you, instead of just assuming that you've understood everything that I've said and dismissing you, I stop and I say, okay, Mary, tell me what I said. Tell me what your understanding is of what I just shared. Tell me what your diagnosis is. Tell me what the next steps are. And that allows me to, it's really like a quiz for me to determine, did I communicate effectively to Mary? And if you don't understand, or if what I'm hearing back is inconsistent with what I said or what I thought I said, then that gives me an opportunity to regroup, perhaps to rephrase, to move away from the medical lingo, or just to really kind of recalibrate and restate it in a way that is easily understood. Unfortunately, because of time restraints, this is not something that is done often in practice. But I encourage you all, to, if the doctor or the healthcare professional doesn't automatically do that, or something that looks like that, just really be okay with saying, could you repeat that? I don't really understand what you said. So I think that's really important. There, in terms of specific questions, because we want to make sure that we provide some guidelines, there is a campaign that I have loved for many years through the IHI, which is the Institute for Healthcare Advancement, and Institute for Healthcare Improvement, IHI, and it's called the Ask Me 3 campaign. And it's really just a framework to provide patients and families with 3 very important questions that you should ask every single time you seek medical care, whether it's in your primary care doctor's office, at a specialist appointment, in the emergency department, regardless of what medical setting you're in. And I wanted to just go through those with you all and get your feedback and see if you have anything that you would add. So the first question is, what is my main problem? And that may sound like a silly question, but a lot of times when we seek medical care, there may be a few things, there may be a few complaints, a few problems, a few concerns that you have. And studies show that many times when patients leave the doctor's office, not a significant proportion of them don't have a clear idea as to what the main problem is. So in medical terms, we say that, that's your diagnosis. And so you always want to make sure that you understand what is your main problem. There may be 4 or 5 things that are going on, but there's usually 1 or 2 main things that stand out. And then the second question is, what do I need to do about it? That really gets to the plan. So a lot of times, we're in the room, we're telling you all what to do. We may be writing out prescriptions or giving you referrals, but not necessarily explaining it in a way that's comprehensive. And so you want to make sure that you always understand, what is that next step? What do I need to do about this main problem that you've just diagnosed, or this main problem that we're discussing today? And then the third question, which is not often asked and is not often answered spontaneously by healthcare professionals, and it's one of my favorites, is why is it important for me to do that? I know for sure that in healthcare settings, we as healthcare professionals often don't explain clearly, or sometimes at all, why we're telling you to do certain things. Why are we telling you to stop doing this or to start doing that? Why do we want you to have this CT scan? Why do we want you to get this blood work done? And if you don't have a thorough understanding and appreciation for why you need to do these things, then it may not rise to a level of priority for you, especially if you're dealing with a lot of other things. If it's something that's painful for you or inconvenient, then sometimes, those directives, so to speak, kind of creep down to the bottom of patients and families' priority lists. And I found, even with my own dad, in taking care of him, there were a lot of things that he was not doing that his doctors had asked him to do. But in delving deeper, many times he didn't understand the importance. He didn't understand the consequences of not following through with those recommendations. And once I had an opportunity to understand that and to help him understand why they wanted him to do these particular things, his entire behavior started to shift. So I'd love to get you all's feedback about those three questions. What is my main problem? What do I need to do about it? And why is it important for me to do these things? And then also, if you have some additional, maybe top 2 or 3 questions that you think are important. So I guess this time we'll start with you, Brian.
Well, it's interesting because, I'll often go into a doctor's office and I'll have a whole, there could be a list of problems. But if I've got 15 minutes with my primary care physician, the question is, what is my main problem? Why am I here? Usually when I see my primary care physician, I'm only seeing them because I have something significant I have to deal with at the moment. Usually it's an infection. Okay, my immune deficiency presents itself as sinus infections first. So, okay, I've got another sinus infection. I'm going in to see the doctor. Okay, this is my sinus infection. What do we need to do about it? What are my options and what should we do? And then there is the question, okay, well, why this over that? Why this antibiotic over that antibiotic? Why no antibiotic at all? But that's my issue. I could have, I could be having, questions about my infusions or questions about something else that may not be as important at that moment. So that's my main issue. Why am I here and what is my main problem? Maybe those questions about my infusions wait until I see my immunologist every 6 months or whenever I see them next. So I think, unfortunately, we might have a number of issues, but some, we do have to pick the main one going in. And then we also have, I know most people with immune deficiencies have teams of doctors. It's not just the primary care physician. There may be an immunologist, there may be a pulmonologist, there may be a gastroenterologist. I've got them all. So I have to decide which main problem goes to which doctor. And that's always another question too. But I like, the idea of going in knowing, okay, what's my main issue? And then going from there gives me at least the structure, I think, and the understanding going in. This is what the deep problem is I need to deal with right now.
Awesome. Thank you, Brian. What about you, Mary?
Well, tapping on to what Brian just said, that is really key, actually remembering who are you seeing, and what is the purpose of the visit, and not getting kind of lost in the other multiple medical problems you have, which are all very important, but you kind of dilute the whole effectiveness of the visit and being efficient with really addressing the problem that is there today. And you answered that very well, both of you. What I wanted to look at a little bit more is people who are coming with a new diagnosis, and that's a little bit more overwhelming. And of course, there's a whole lot of questions with that, and everything you listed, Nicole, absolutely right on. Those are the first things you probably want to ask, but it's hard for a new diagnosis person to stop there because there's always a few more that they want to get in there. And it's kind of difficult because you can't answer all of these questions in one session, or I should say you actually can't. What happens is if you go longer than an hour, this is usually my limit, is if I've been talking for an hour, we have to stop because you are going to forget everything we just talked about. You become overwhelmed. So that's another reason to have a list of a few really top questions to get those addressed, knowing that you can come back. Once you've got an understanding of those basic ones, come back. And now I can ask some other questions, which actually will mean more because I have this basic understanding. But there was a couple things I did want to throw in there. The last thing you said was like, why is it important for me to do this? And that almost sounds like I'm getting ready to leave the office, right? So before you leave the office, it's always, you should ask, what's next? What is actually happening next? Because you want to know, am I getting that CT scan, or I have to go get this lab, or I have to see this person? You say all this, they leave, they're all confused about what am I supposed to do? So always ask, what is the next thing that I have to do? And then the other question is, I would like somebody else maybe to hear this with me, because it's hard for me to remember all of these answers. Can I have somebody else here to have this discussion, or can I get them on the phone? A lot of times in the clinic visit, they'll, on the phone get their significant other, parent, or whatever, or so they can listen to everything that you're saying. And I think that is helpful, and you should ask that. And I can't see any provider saying no, that they wouldn't do that. The other thing is, when do I see you again? So you have some idea, what is the time frame to get all of these things done, that I know that I have a follow-up appointment. It isn't just something nebulous out there. You always want to have some closure when you're leaving. And then maybe one other thing, I mean, it depends on what the diagnosis is and what's been going on. But, if you're really afraid of something, there's that unspoken worry in the room. And sometimes when people say immune deficiency and you hear all this, you start thinking all of these really terrible things. And sometimes you worry more than you need to be, and ask that question, bring it out there. I am really, really worried about this with my child. You don't want to leave there having that unanswered and have that, concern and worry dragging on for a long time. Get that out in the open before you leave.
Oh, I love that. I love that.
I think one other
thing, yeah, Brian.
I'm sorry. I think one other thing when you're in these appointments that's very important is having a pen and paper. And maybe some people are better at taking notes on their phone than I am, but I am not good at that and not quick enough. But going into the appointment, if you have something written down, questions written down, I think that's incredibly helpful, because you've already put thought into what you want to know. But having something to take notes on while you're there, so when you're getting these answers, when things get overwhelming, you're writing things down that you can then look at after the appointment, either during the appointment and say, hey, wait a minute, you said this, what does that mean? Or even if it's after the appointment, because it's impossible to remember everything that's said sometimes, especially in the longer appointments when there's more conversation going on. I've walked out of appointments. I have notebooks and, that have plenty of, my notes in them. And I never throw anything away. So I've got notebooks from 20 years ago. That I don't need anymore. But yeah, it is even if I don't have to look at it anymore, it's a relief to know that I have it. And if I have another question, what did the doctor say? Like 2 weeks later, I can go back and look and say, okay, look, this is what my notes said. It's incredibly important for us to have a way to record what's going on in the appointment, just so we have it for either in the appointment or later.
And one more thing, actually, onto what you said, Brian, which I didn't mention, and maybe I was just assuming it's a given. But again, when you leave, it's like, who do I call if I have problems or questions, especially with the new patients?
That is so important. Everything that you all have said is so incredibly important. The notes, I am a huge advocate of taking notes. I'm a huge advocate of having a buddy, someone in the room or someone on the phone, on FaceTime these days, somebody else, because like you said, I mean, a lot of that information really goes in one ear and out of the other, particularly if there's bad news that's being shared. If this is your appointment where you're getting a diagnosis, there are lots of studies that show that I think it's something like patients only retain about 50 or 60% of what we say. And so being able to write that down, I am a notes person, Brian. So when I was taking care of my dad, I definitely would type on my phone, but I just happen to type faster than I write. But many people prefer, pen and paper. I love the idea of a notebook. I remember as a pediatrician, some of my favorite parents were those that came with the notebook with every detail. And it's really such a great way to advocate for yourself. It's a wonderful way to advocate for your loved ones if you're caring for someone with PI, because a lot of times we assume, or you may assume in this era of electronic medical records, you may think that everything the doctor needs is right there, just with a click of a button. And Mary's laughing because she knows that is absolutely not true. If you're lucky, your doctor's office, doctors, as Brian said, your doctor's offices and the hospital where maybe sometime you get care are all connected. But in many cases, there's one electronic medical record being used here. there's a different one being used there, and they do not, as of yet, communicate with each other, which is something that's incredibly frustrating for those of us who are, wanting to take care of patients in the best way possible. So often, and we said this earlier, you are the expert. Often you may be the only one who has all of that information in one nice package. And so having notes either in a notebook, in a telephone or an iPad it's so incredibly helpful for your healthcare providers. And you all are often the ones that fill in the gaps. Sometimes you're the ones that are correcting misinformation that has inadvertently crept into the chart. And so it's so important to do that and to have someone else with you that can kind of help you in that process. We talked a little bit about new diagnoses, and I want to go back to that for a minute, because we know that for many patients, but particularly for patients with rare disorders, rare diseases, it often takes a long time to get that accurate diagnosis. And many patients and families have stories of having to go to multiple doctors, presenting to the emergency department over and over again before they finally got a diagnosis. And many times they will say, I knew something was wrong. I had a gut feeling, and they felt like they were being dismissed by members of the healthcare team. So as we talk about how best to communicate with your healthcare providers, I would love for each of you to share any tips that you have specifically for those in the beginning part of this journey who are, newly diagnosed or trying to figure it all out and feel that they're getting some resistance from their healthcare professionals. Can you share some tips, Mary? And then we'll go to you, Brian.
Well, I'm wondering if you're talking about, the healthcare professionals that aren't the immune deficiency experts, because the immune deficiency experts, when you come with this story, it's like, I've heard this story like 50 times. I already know where this is going. I think I already know what's wrong with you before we've even, explored all of that. What you might want to say to the other people, because they do feel like, and they do see every day, of course, I think you all realize that people with multiple complaints that really haven't risen to the serious diagnosis as immune deficiency, and they see more of those than they do see of immune deficiency. You can always say, is there someone else I can see for another opinion? And, I would say most healthcare professionals are fine with you seeing somebody else for another opinion. What they can help you with is finding people in your area, probably that are easily accessible for you or for your particular problem. They might be able to help refer you again on to someone else. I mean, there's a lot of experts, in the country, but it isn't accessible for everybody to travel to some of these places. But usually in a regional area, probably within at least 3 or 4 hours of your home, there's probably somebody with a level of expertise that can help you with all of that. And I would pursue it. And the other thing is do some reading, contact other places like the Immune Deficiency Foundation. They provide a lot of information. They have a list of experts out there. You could do some reading and find out, wow, all of this information sounds like what I might have. And you have to remember, as Brian is mentioning, these are rare diseases, and even trained immune deficiency professionals have not seen all of these rare diseases. There's often a handful of patients with these particular problems, and they might read about them, they might study about them, and depending on the size of their practice, they may never have seen a patient like this. So it doesn't hurt to bring your information, your data, your concerns, and if you can't help me, please redirect me to somebody who can.
That's great advice. And I just want to reiterate what you said about second opinions. If you are seeing a healthcare provider that is not open to facilitating a second opinion, you probably need to consider getting a new healthcare provider. That's an ego problem, and that is going to potentially interfere with your ability to get exceptional care. So I appreciate that. Brian, do you have any tips, or have you experienced this in your journey?
Well, again, sometimes it's up to us to educate the doctors or the providers. And especially with a new diagnosis, and if we're dealing with a physician or a practice that isn't an immune deficient expert, maybe it's our primary care physician who, through blood work or through tests has identified an immune deficiency. It is going to be up to us to help educate them. It is, unfortunately, there is an onus on us as patients to advocate for ourselves. Mm-hmm. And as Mary mentioned, the IDF is the place to be, the place to come to. And be able to obtain all of this information that's available from IDF that we can then share with the physician or share with the practice and say, look, this is what I have. You just diagnosed me with this. You may not have access or have time to go to IDF and learn about it, but I do, because it's my body. And so this is what I've learned. And, you know, you don't have to learn this here in our 15-minute appointment, but this is, if I'm going to be in your practice, you need to know about me. And so this is what it is. You know, and hopefully ideally the providers should be able to take that information and learn from it and be able to treat you in the future because of it. But, you know, we have to advocate for ourselves a lot of times, more than I think we'd like. But if the more that we're able to do that, the more we're able to access resources at IDF, we're able to put together the kind of questions we need to ask. We're able to understand the basics of what we have in order to go into a physician's office and say, now, look, this is what I have, and these are my questions around it.
You know, another point to make too, Brian, when you're mentioning all of that is sometimes the physicians don't know how to find an expert physician. And within the IDF, they actually have the listing of the physicians. So you might want to tell the physician, go to this website, and they will list all of the experts in this area. And they're very receptive to being contacted by any other healthcare provider to ask questions. And that might be a step that kind of pushes them in the right direction to help you.
Excellent. Excellent advice. Well, I can't believe that 30 minutes have passed, but they have. And so we're going to move to Q&A in just a moment. But before we do that, I'd love for each of you to share any closing thoughts that you want to share about this topic. We'll start with you, Brian.
Well, I think I just sort of shared my closing thought is that we have to be our own advocates. It's important for us, not as patients, as caregivers, as parents of children that are our patients. You know, it's up to us to learn as much as we can about our own diagnoses, then take that information into our providers' offices. You know, the more we know, the better the communication will be with the provider, and the more we'll be able to understand what the provider is saying to us. And so I think that's, you know, it's on us as patients. And I think, you know, we've got, you know, 120 people on this forum that are patients or caregivers. So this is the first step is to come to a forum like this. You know, the next step is to look at all the information IDF has, you know, take part in all the IDF other events. We're educating ourselves so that we can then go out and be our best advocates.
Awesome. Be your best advocate. Absolutely. What about you, Mary?
Well, I can maybe speak a little bit to the providers, and this is a thought for the IDF, whoever is still from IDF listening to this. But how about a forum for teaching healthcare providers how to speak to their patients better? You know, some increasing their health literacy with the patient, because as we said, communication is a two-way street. And I do believe when you are working in immune deficiency, you're here by choice. You didn't just end up, you know, doing this specialty. You are committed, you are dedicated to it. And most providers really want to do the best that they possibly can for their patients. When I meet a patient for the first time with a new diagnosis, I'm thinking, this is the beginning of a new relationship, because you know that we're going to take this journey together. And I say to them, once you meet me, we are going to be very good friends for a very long time, because there's going to be a lot of questions. There's going to be a lot of issues that come up. And during that journey is really when you help educate each other. I educate them about their disease and the treatment. They educate me about what experiences they're having and what are their barriers to the best possible healthcare. So it helps me, you know, change my practice. So I'm throwing that out there as, you know, a session for the healthcare providers.
Add my vote to that.
Okay.
I love that idea. Absolutely
Okay.
love that idea. And I guess my closing thoughts would just be, you know, you are the expert. And I feel like we've talked about that in many ways this evening. You are the expert. Be confident in that. Even if you're in the early stages, even if this is a new diagnosis for you, trust and believe that you know your body better than anyone else. And like, you know, with the resources that have been mentioned, you have the ability to learn about your diagnosis. You are the expert. And really see your relationship with your healthcare provider as a collaboration. We are way past the days where there's this hierarchical relationship where the doctor's here and you're here and yes, doctor, no doctor. You are an integral part of the healthcare team. And so really embrace that identity. So with that, I want to thank you all for listening, and we are ready to move into our question and answer session. So I think Colleen is going to give us some questions.
I am. Thank you, everybody. This has been great information and will be well received by everybody. I'm going to turn it just a little bit right now in a different avenue. We have a couple questions that are related to employers and work. And I think this is another facet of asking not just your physicians, but asking others, how do I deal with a certain situation? And Brian, I think you have a great perspective, and the others also. One is, how do we navigate getting work from home accommodations from and for employers? So Brian, I'll let you start and then everybody else can chime in. But how do we get this virtual world where some are now saying, okay, we're kind of coming out of it, you got to go back to work, or it's just better for you all the way around to work, you want to work, but you need to work from home?
Well, dealing with a work from home situation, there are laws that protect people with disabilities. And is working from home a reasonable accommodation? Is it necessary? Or is it reasonable? It doesn't even have to be necessary. So there are ways to approach, our employers and their HR departments with, with medical documentation that shows we have a disability. I have a disability, and I need reasonable accommodations. I can still do the work, but I may need to work from home. And under the Americans with Disabilities Act, there are certain ways that the law says that your employer has to give you a reasonable accommodation. And so, not knowing, every situation is fact dependent, and therefore, it depends on your facts. But for the most part, if the employer agrees that it's a reasonable accommodation and it doesn't impact their business, which now we've been living in a virtual world for 2 years, the world of working at home has changed for most, a lot of professions or a lot of jobs. So it often can be a reasonable accommodation, but there are certain laws and that will protect us from that. I can eventually we will have another topic just on employment laws, and I do give one every time at the national conference. So we can those questions are probably better answered in a forum like that.
You're muted, Colleen.
Sorry. We've gotten a lot of questions on communicating with your doctor, but a lot of concern with communicating with multiple doctors. So if you have, and I think we all can agree, you have one main person who is in charge, but you've got all the others that are underneath, but they all need to know what's going on. How do you do that? What do you recommend? Mary, I'll let you start.
Mm-hmm. That can be tricky because it depends on what these other problems are. It also depends on the age of the patient. I think it's a little bit easier to get group communication with pediatric patients and multiple specialists, because often all of those specialists are in one institution. It's a little bit harder when you're an adult and you are seeing specialists in multiple, I'm sorry, maybe I said that wrong, that the pediatrics are all in one institution and the adults are usually in multiple institutions, and that can be a challenge. I mean, one thing is to always make sure that you maybe get a copy of the clinic notes that were provided at each specialty visit, and you bring that with you to your other visits. They can be sent to the other specialists by the certain provider, but I will say a lot of times those get lost in the myriad of medical records and they don't get read. So you can also ask your provider with a particular issue to make sure that they contact that other specialist to help you with that problem. But really for adults, you end up being your own case manager, and that can be a real challenge. I would ask actually somebody in the nursing staff area to really help you with case management activities and provide you some guidance. I don't think I answered that very well, but it is a very difficult question, not easily solved. And I don't know if Nicole maybe has some better suggestions.
Well, I wouldn't say better. I think you answered it well, Mary. I definitely have a couple of things to add. I mean, this is it was one of my biggest pet peeves as a caregiver to my dad, who had a lot of chronic illnesses and lots of different specialists, and none of them were speaking to each other. And so I certainly appreciate this question. And it goes back really to what Brian was saying. And I hate to say this, and you said it too, Mary, it's part of being your own advocate. And unfortunately, some of that burden of bridging the gap and bridging the communication gaps between the providers ends up falling on the patient and their family members, which is completely unfair. Going back to that electronic medical record I spoke about earlier, in an ideal world, this Dr. A would be able to see what Dr. C wrote and just click a button. That just doesn't happen. So I totally agree with what Mary said about getting your own copy of those clinic letters. And I also have to say, Mary alluded to this, sometimes those letters are not read. Sometimes they don't make their way into the chart, but sometimes they do. And particularly, some primary care providers are just so overwhelmed that these letters are coming in left and right from all of their patients. And you didn't hear it from me, but sometimes they just stick it in the chart back in the paper days, or maybe it gets scanned and put in that electronic record, and they may or may not even look at it. And so it's okay when you go to that visit to say, hey, Dr. Jones, I saw my gastroenterologist, Dr. Martin, the other day. Did you happen to get that letter? And then, or maybe not even say, did you happen to get the letter, but just assume that they either haven't gotten it or haven't read it. And then you can just very briefly give that provider a summary of that visit. This is another valuable use of that notebook that Brian was talking about. I always recommend that my clients get notebooks with folders and pockets and things like that, so that when you get those letters, you can just slide it in the pocket of one of those notebooks or folders. And then, you can just briefly kind of go through the summary of those letters. And again, I hate that this is necessary, but often you are the only one that's going to have that information. And so making it a point to summarize what happened at your visits with the other providers is incredibly important. Also, making sure that you have an accurate and up-to-date medication list. Because another thing that happens when you're seeing multiple providers is that sometimes there's duplications of medications. Sometimes one doctor may be prescribing another version of the similar medication or something that treats the same problem. And that can be a nightmare in terms of side effects and complications. So really just being your own advocate, keeping a really good list of your medications, keeping up with what was recommended by your various providers. And then you kind of become the captain of the team, and you're the one that's relaying that information to the other members of the healthcare team.
Keeping the notebook I found very helpful. I mean, 10 years ago, I had a liver transplant, and I had a 3-inch binder I carried around with me everywhere. And each one of my providers knew I was coming in with that binder. And they knew I was whipping out something to give to them each time. And I'm fortunate, I have almost all of my providers in one health system. And even though they're all in the same health system and they can all just click on one button and see what my lab work is that another provider ordered, I make sure I print it out and give it to each one. So it goes in the paper file in each one of their offices. I shouldn't have to do that, but I do it makes their life easier. Another thing is because we all have, now most doctors' offices have an electronic medical record that's accessible to the patients. When it comes to my medications, I can just pull up the app on my phone, and I can when I'm talking to to the nurse or the assistant in the beginning of my appointment, and we're going over medications, I pull up my app and I have it in front of me, and then I can just go over each and every one of those medications, and I have all of my dosages and everything right there. So it's in my phone. It's in my pocket at all times. So that's another, a great thing that I don't have to worry about it on paper anymore. I've got it in my phone. And there are other apps that can, we can record, important information like that in. So there's a lot of different ones. So, everyone has to choose what's best for them. But I think that's another very helpful tool in our arsenal.
And as Brian mentioned, just quickly, because I know you have other questions, for each healthcare system, they usually have their own specific patient portal. So you might have to have multiple patient portals on your phone, but if you are in a visit with somebody and they don't have access to that healthcare system, then you could pull up some of the labs like Brian mentioned and maybe show it to them that they didn't have access to.
Thank you. I'm going to go back to the chart, and you have mentioned it several times, but what do you do when you find out that inaccurate information has been put into your chart and you know for a fact that it's in there and it's wrong? How do you get it changed?
That's a great question. As part of the HIPAA law, which I'm sure all of you have heard that law, it's the Health Insurance Portability and Accountability Act. That's part of that law. Everybody only uses it to block people from getting information and things like that. But another key element really has to do with your access to your own health information and your ability to see your information and to make corrections. So if you notice that there are things in your medical record that are inaccurate, first of all, please speak up. Please speak up. Let the provider know, let the front desk staff know. And then most offices will have some formal process where, some form that you may need to fill out, identifying what's incorrect, and then, a place where you can write in what is the correct information. And then they have a certain amount of time. And Brian may be able to weigh in on this part. I'm not a lawyer, but there is a certain amount of time, I think, that the providers have in order to make that correction. But it is your right to remove that inaccurate information from the chart. And I think a lot of times individuals aren't aware of that, or they question themselves wait, is that right? But if you know that something's incorrect, it's really important to correct it. One more thing I want to say quickly before I have Brian and Mary weigh in is that sometimes this information, particularly now that we're in the electronic world, it gets copied and pasted. I'm just giving you guys all the inside secrets. But sometimes in an ease and in an effort to expedite medical appointments, particularly in hospital settings, information is sometimes copied and pasted, especially if the provider is under the impression that that information is accurate and that it hasn't changed. So some of your past medical history, as an example. And so if you don't correct these errors, they just follow in perpetuity from chart to chart to chart to chart. So it's really, really important that if you recognize that it's wrong, that you speak up. So I'll pass it on to my co-panelists.
Yeah, Nicole, I think you summarized HIPAA very well. And you also summarized the fact that, yes, things get copied and pasted. And if something's entered wrong at one point, it very well could continue to be wrong. I think ideally, most providers want to have what's correct in the chart. And so the first step would be to bring it up to the provider, either the provider or probably one of the nurses. They're probably more appropriate to handle what's in the charts. But to say, look, this isn't correct. If you have another document or something that you can say, this is the actual test result or whatever it is, that would be better. But ideally, most providers' offices are going to want to change it on their own without having you have to assert your HIPAA rights. If for some reason you get pushback, then you have the right to review your chart. You have the right to say this is wrong, and you would put it in writing and say this is wrong and this is why it's wrong. And then they have to either correct it or they put in your note that says it's wrong right next to whatever they think is right and you think is wrong, but at least your note is in the chart. So ideally, most providers' offices are going to want to correct anything that's wrong. So I bring it up to them, do it informally. But if it stays that way or you get pushback, then you have the right to, in writing, tell them that this is incorrect, and that has to either be changed or go into your chart, your note.
And I would add to that, I mean, Brian, you're absolutely right. The providers want to know the correct medical information so that they give you the correct care. You don't want to make assumptions based on errors. And a lot of times right in the visit, you can correct it. It's depending on what exactly is the error, but in the record, when you are doing your visit with somebody and you're going through the history part of their clinic note or maybe labs, you can actually correct it on the spot right there. I've done that many times with patients, taken out incorrect information and replaced it with correct information.
Thank you, everybody. We've talked about dealing with as a new patient, with a new doctor, with a doctor that you've been seeing. But what happens when you are in the doctor's office and you're not being heard, or you're sort of explaining your situation and you're being brushed aside? You're being brushed off. You're not being taken seriously. We have a couple of questions of, how do I avoid being pushed on to another doctor instead of dealing with me? How do you deal with a care provider who continues to ignore you because your situation doesn't seem realistic and they call you a drug seeker or something like that? Or you bring in paperwork and you've got all the stuff, you don't understand it, but they don't want to take the time to explain it. They want you out the door because I think sometimes they don't have the answers. But what do you do?
Well, I'm going to put this on the providers here on this call, because as a patient, I mean, it's much easier said than done, but we do have the opportunity to go to different doctors. And I think sometimes people are seeing a doctor, have been seeing a doctor, and are sort of tied. They think that they're tied to that physician. And it's because it's a lot harder to have to start over with another practice someplace else. But if that is it is an option, then it is an option that we can take advantage of if we are not being heard and we're not getting the best care. It's up to us to find the person who is going to give us the best care. And so, like I said, I know it's easier said than done. Some parts of the country, there aren't a lot of doctors to choose from. But if it's possible, it is up to us to find somebody else. A lot of times, but then I will also defer to the providers here as to what does a patient do when the provider is not listening?
Well, there's also the other thing to think about is there are other people in the clinic or the hospital besides that one physician. And you do have the right to say, I want to speak to like the manager, the director, the administrator, so that you can convey your problems with that particular provider to them, because it doesn't just affect you, it probably affects multiple patients. And most of these practices do want to make sure their providers are interacting appropriately with their patients and they're giving good care. And they would want to know about it. And maybe sometimes just a little discussion with them will really make a difference. Again, if you feel like you have to stay with this particular provider, you're looking at ways to improve that relationship.
I agree with both of you 100%. The only thing I'll add is that sometimes there are sometimes that the doctors, the healthcare professionals are on like automatic, you know what I mean? Like they're just going. And there are certain things that you can do or say as a patient, as a family member, to kind of reset things. And I've done this myself in healthcare settings, and I've had it done to me in full transparency. And so certain phrases, like literally calling it out and saying, I don't feel that you're listening to me. I feel like I'm being rushed. Would you mind taking a few moments to explain this? Literally saying that. Mm-hmm. There aren't that many providers. There are a few, but there aren't that many that will hear that and then just proceed to walk out of the door. So sometimes we really have to feel comfortable, naming it and saying exactly what we feel. Also saying things like, I feel unsafe. I'm worried. These are things that you can say that usually will just snap that doctor or that healthcare professional out of their robotic movements when they're trying to take good care of you, but they also have all these outside pressures and just being human and just expressing how you feel and naming what you're experiencing in that moment. Now, I'm not saying it's going to work all the time, But in many cases, it can just be the thing that makes that doctor take their hand off the doorknob, turn back around, sit back down, and re-engage.
Thank you. So the last question for this evening, and Brian, I'm going to start with you as the patient. Walking into an ER or an urgent care, we all know that is a scary, unpredictable situation. So any words of wisdom as to how to address the clinicians that are there with your diagnosis and how to treat you?
Well, here comes Brian with his binder. If I'm going to the ER, I'm going prepared with as much literature and information as I can. Even if it's just before I get there, I print out the hyper-IgM syndrome section of the PI book that from IDF. Each one of the different diagnoses are available on the website. You can print out, you don't have to take the whole book. You just have to print out your specific diagnosis. Even if it's just that I'm going with. Usually if I'm going to an ER, I have, I'm going to the same hospital that I have all my providers in. So I have my app and I pull it up and I can say, first I can hand them the diagnosis pages, but then I have all of my information in front of me right there. Or, my caretaker, has it all for her. And if I'm, for some reason, wasn't able to have it or would communicate it. So going to the ER, you got to go prepared as much as possible. So that means, today you don't have to go to the ER, but you have that printed out and it's somewhere just in case. It's part of that, of your emergency package that just in case you need to, you're going to end up in the ER, you're going to go, I'm going to go with my documentation that I can hand to whatever person I'm talking to, whether it's the intake nurse. And if I have to take multiple copies, I take multiple copies, but I make sure that it gets to where it needs to go. I don't just give it to somebody and they just put it on their desk. I make sure I take it with me to every different place that they send me in the ER. I don't give it to someone and let them keep it. I make sure I have it. So each person, until I give it to finally I'm seeing the ER physician that I'm dealing with and the ER nurse, they get to look at it and take their time to read it. But I just it's a matter of just being as prepared as possible.
Mary?
Well, a couple of things besides what he said, because that's excellent advice. And again, the IDF has wonderful resources, and that one handbook that they do a good explanation of many of the primary immune deficiency diseases, but they do it in a readable format and somewhat succinct, because Brian's life is probably many, many binders, but you're trying to get to, the little bit that's really relevant to what's happening today that you ended up in the emergency room. This is somewhat timely because actually the Nurse Advisory Committee within IDF is working on this document. It's kind of a one-page document, a few salient points on there, like what is my disease? What is wrong with my immune system? What type of problems do I have? And what kind of treatments do I need? Just provide some quick guidance that you could hand to somebody when you do end up in the emergency room. And then actually some of the providers for certain patients, and I've done it for some of my patients that have really unique circumstances, have a little summary letter for them about the problems that usually occur with their particular disease and things that they want to consider when they're planning treatment for the patient.
Perfect. Thank you. And we should have a document probably by the end of February for sure. Mm-hmm. So that's going to be a great resource to have. But Nicole, I'm going to let you finish as the physician who is now looking at this patient and hearing what they're telling you. What do you want to hear to better understand what they have?
I love if someone were to give me that piece of paper that Mary's talking about that summarizes exactly, what the diagnosis is, what the treatments are, or if someone like Brian came in with a binder and like a one-pager that explained the diagnosis, I would, I'm not an ER doctor, but if I was, I would be so excited about that, because as you all know, that's a very fast-paced environment. They have even less time than all the other providers that we've been talking about tonight. So they really need the most important, most pertinent information. So I think being as concise, as thorough, but as concise as you can be is incredibly important. And sometimes, leading with, hey, I know you don't see many patients like me, so I'm here to help you out. You know, sometimes you have to infuse a little bit of humor. And also we talked earlier about that ego. So by saying it that way, it may mitigate any type of resistance or, oh, he thinks he's the expert. But just say like, hey, you know, I have a rare disease. You probably haven't seen anybody like me in the last 5 years. So let me make your life easier. Here's this piece of paper. This is everything you need to know about my diagnosis. And they'll probably have a little chuckle and they will take a few minutes to look over that. So I think that's incredibly important.
Well, thank you, every single one of you, for volunteering your time tonight to prepare for this, to be here, to answer the questions. And I'm going to start with Brian and then Mary and then Nicole, I'll let you finish it, but parting words of wisdom for everybody here.
Well, I think the most important thing to know is that we are our own advocates and our own best advocates. You know, it's up to us to know the basics about what we have and be able to take that into our providers' offices. You know, no one's going to advocate for us but ourselves, and no one knows our bodies but ourselves. So no one can tell us what we're feeling and what we feel like. We know, you know, what's going on inside of us.
I guess I'm up. I would say everything that Brian said about advocacy is correct, but I would say as a patient, look for a healthcare team that wants to partner with you in your healthcare, that they really show an interest and a desire to help you reach your best potential. And don't stop looking for the best provider possible. Don't settle for something. Keep looking.
And on that note, my closing thought is that there are amazing healthcare providers out here. And so if that hasn't been your experience, keep looking. Like Mary said, keep searching. They do exist. And really see yourself as an integral part of the medical team. If we've said things today that you are thinking, oh, I've never done that, you know, then that now is a great time to begin implementing some of the strategies and suggestions and tactics that we've talked about today. So I just encourage you to maybe rewatch this, go back and look at the recording, rewatch it, watch it with your family members, with those who support you on this journey. And I wish you all the best.
Thank you, Mary, Brian, and Nicole. This has been very informative.
Thank you for having us.
Thank you. We enjoyed it.
So thank you, everybody, for being here. Again, we have the Get Connected groups that I encourage you to be a part of. I encourage you to register for the COVID-19 forum. You can ask your questions ahead of time, or you'll be able to ask again that evening like we did tonight. And as always, you can submit questions through the website through Ask IDF. No question is stupid. No question should be a concern. If you don't understand something and you want to know more, that's what we're here for. We can connect you through peer-to-peer. We can connect you through other groups that you can talk to people. You're not alone in your journey. We are all here for you, and we will provide you with the resources and everything that we can to make your journey as easy and wonderful as possible. So again, thank you for being here. And we look forward to seeing you on February 3rd.